So the Piezowave has made a big difference in patients' lives. We've seen a big difference when it comes to things like plantar fasciitis, knee arthritis, lumbar disc herniations, inflammation in the sacroiliac joint. I have certain patients that could barely walk. They had trouble walking and stepping, walking on the beach with their grandchildren. After using the Piezowave, they have no problem with any of these activities. I had a guy that was a stuntman, and he had a lot of pain with, with just his playing sports. He's kind of retired as a stuntman, but now that he's playing sports, he continues to play baseball. Now he can easily play baseball. I have one gentleman who had a knee replacement surgery, and the Piezowave was able to speed up his recovery. I had another gentleman who could not even pull up his underwear. He had a hard time pulling up his underwear in the morning because he had such a lack of grip strength. Once using the Piezowave on his wrist and his fingers, he's now able to pull up his underwear, which was difficult before. Another lady, she had a lot of ankle and foot pain. And her big thing was that she wanted to walk around Disney World, and she couldn't. She had to get a wheelchair and have her family push her around Disney World. After doing the Piezowave, walked around Epcot, went around Disney World, no problem at all. It works by using compressed sound energy. It's a pressure wave. It's the same technology they use to break up kidney stones. But somebody much smarter than me said, well, what if we take this and we make the power much less? Will it break up arthritis? Will it break up scar tissue? Will it break up adhesions? It turns out the answer is yes, it will. It stimulates the growth of cartilage, muscle, and bone tissue, okay? So any problem that involves any of those tissues, the Piezowave can help. Knee arthritis, hip arthritis, elbow, wrist, ankle, the bottoms of your feet. I have patients I've treated their neck. I have patients I've treated their mid-back and their shoulders. Just about every joint in the body. Anything involving muscles, joints, ligaments, and tendons, the Piezowave is perfect for. One of the things that you want to look at when you treat a patient is you want to look at harms. And as a doctor, you take an oath. First, do no harm. That's called the Hippocratic Oath. A lot of medications and a lot of other treatment options can do harm. You can't do harm with this. Think about what you're doing now. If you're taking medications like Advil or Tylenol, well, that's not exactly good for you. I mean, Advil, for example, is really rough on your kidneys and your stomach, and Tylenol is really rough on your liver. This doesn't do anything to your liver or kidneys. All it does is treat the problem moreover. The Piezowave is perfect for someone that wants to stay natural. They want to stay with a holistic treatment plan. We get similar results to a steroid shot. We get similar results with medication. But the nice thing is, most areas, most problems take about 6 treatments. You space the treatments out 1 week apart, and usually by the 2nd or 3rd visit, people really notice a huge difference, and the relief tends to stick around after 2 or 3 visits. It's holistic, it's natural, it's safe. It's a very low energy device, and it stimulates, it breaks apart adhesions, it pushes the neurotransmitters away from the painful nerve endings. It's able to regrow cartilage, muscle, tendon, and bone tissue, and it allows for blood vessel growth. There are no side effects. There is no downside. It does cause a little discomfort. But the nice thing about that is I have a button that can turn the amount of energy that I'm putting into the patient down to make them more comfortable. So if you're worried about a little bit of discomfort, we can make it more comfortable for you when you come in. One of the things that the patients really like about this is patient directed. When I put the device over a patient, over normal tissue that has nothing wrong with it, they feel absolutely nothing. But when I put it over an area and it hurts, it means that there's a problem there. And the patients can direct me to the area. On the second visit, the patients actually look forward to that discomfort because it means that we're actually treating something that needs to be treated. And the other thing, it gives the patient validation. There is actually a problem there, and we're fixing it. And they actually get to feel the problem go away, right there in the office, right during the treatment. From what I understand, this is the only machine in this area for hundreds of miles. It's only been available for 4 years here in the United States. It's been available longer in Europe where a lot of the research has been done, but here in the United States, it hasn't been here that long. This machine sets us apart because it represents a brand new advancement in the technology in the field of musculoskeletal medicine. We can treat muscles, ligaments, joints without medication and without surgery and produce lasting results. Piezowave is going to be what I consider a second-tier treatment. Mostly we're a chiropractic office, but this is a nice option to have for the patients that don't respond to our first-line treatment. Not everybody needs it, but the patients that have a hard time to adjustments and massage and they don't get better from those things, it's nice to have something like this to fall back on that we can treat them with. You really have nothing to lose. Nothing to lose except for your pain.